Could adding just 14 steps per minute to your normal walking pace help you regain stamina, walk farther without fatigue, and reduce your risk of losing independence?
Welcome to Dr. Mercola's Cellular Wisdom. Stay informed with quick, easy-to-listen summaries of our latest articles, perfect for when you're on the go. No reading required. Subscribe for free at mercola.com for the latest health insights.
Hello, and welcome to Dr. Mercola's Cellular Wisdom. I'm Ethan Foster, and today we're looking at how a small, deliberate increase in your walking speed can produce meaningful improvements if you're dealing with frailty or beginning to notice early signs of slowing down.
I'm Alara Sky. Frailty is more common than many realize. If you've unintentionally lost 10 pounds in the past year, feel constant exhaustion, struggle to stand without assistance or maintain a firm grip, rarely do chores or hobbies, or take more than 6 or 7 seconds to walk 15 feet, you're seeing hallmark signs. These changes make recovery slower and daily life harder, but they are not inevitable, and they can be improved.
University of Chicago researchers tested a simple idea. Could increasing walking cadence, the number of steps you take per minute, drive real gains for older adults who are frail or pre-frail? In a structured program, participants who could walk at least 10 feet with no more than moderate assistance were split into two groups. One walked at a comfortable pace. The other walked as fast as safely possible, aiming to raise cadence and hold it.
The program ran for 4 months and included 48 supervised 45-minute sessions in 3 phases. During acclimation, participants settled into a steady routine. In the ramp-up, intensity increased, and those in the faster group were guided toward about 70% of maximum heart rate, a moderate to vigorous zone for older adults. In the intervention phase, they maintained target pace and intensity with regular prompts to keep cadence high.
By the end, median cadence in the faster group reached about 100 steps per minute, compared to 77 in the comfortable pace group. 65% of the faster walkers improved their 6-minute walk distance by at least 30 meters, a clinically meaningful gain for frail adults, while only 39% of the slower group reached that benchmark. The takeaway was clear. Add roughly 14 steps per minute over your usual pace, and your odds of better mobility rise.
Why does this work? Increasing cadence recruits your muscles more frequently, challenges your cardiovascular system, and improves oxygen delivery to working tissue. Over repeated sessions, you build endurance and efficiency so you can cover more ground with less fatigue. Because walking is low impact and accessible almost anywhere, you can apply this approach without special equipment or a gym.
There are broader benefits too. A modest amount of regular walking supports longevity. Even hitting 8,000 steps on just 1 or 2 days a week is associated with lower all-cause and cardiovascular mortality. If you're already walking, raising cadence on select sessions turns a familiar habit into a targeted stimulus, pushing strength and endurance forward in a manageable way.
Research also links brisk walking with dose-dependent reductions in chronic disease risk. You see improvements across cardiovascular and cerebrovascular health, type 2 diabetes, cognition, mood, sleep, and overall longevity. Meeting common activity guidelines, brisk walking for 30 minutes a day, 5 days a week, helps reduce the risk of several age-associated conditions, and adding cadence gives you an extra lever to pull.
To put this into action, start by measuring your baseline cadence. Count your steps for a full minute during a normal walk, or time a few minutes and average them. From that baseline, nudge speed up slightly. The target is comfort with intent, fast enough to notice the change, steady enough to sustain it. As you adapt, you'll feel your breathing and rhythm settle into the new pace.
A smartphone tool to make this easier is in development. The Walk Test app is being designed to measure cadence accurately through brief, deliberate walking tests. Validation testing has shown strong accuracy when counting steps per minute, and the interface is being built to be low barrier for older users. While that's in the works, a simple metronome app is a practical stand-in.
Set the metronome to a beat that matches your baseline, then add a few clicks to guide your feet. Synchronizing steps to a steady beat helps you hold pace consistently across a session instead of drifting slower when you fatigue. If you find yourself slipping off rhythm, pause, reset the beat in your head, and resume at the target tempo.
Here's a straightforward progression you can start today. For a week or two, add about 5 steps per minute to your usual cadence during select walks. Once that feels comfortable, build toward adding a total of 14 extra steps per minute over time. If staying on pace is challenging, use the metronome until the new rhythm becomes automatic.
Support faster walking by strengthening your legs and hips 2 to 3 times per week. Simple movements like squats, seated leg lifts, or light resistance band work are enough to make a difference. Even modest strength gains help you maintain posture, control foot placement, and feel steadier at a higher cadence.
Nutrition matters for energy. Aim for around 0.8 grams of high-quality protein per pound of lean body mass each day, with about 1/3 coming from collagen-rich sources such as slow-cooked meats or bone broth. Include at least 250 grams of clean carbohydrates daily from fruit, root vegetables, and other whole food sources to support energy production. Stay away from seed oils and processed foods loaded with linoleic acid. Removing these helps protect your health. If you want help tracking linoleic acid intake, you can join the waitlist for the Mercola Health Coach app, which includes seed oil sleuth to calculate your intake to 1/10 of a gram.
Recovery habits amplify your gains. During walks, practice nasal breathing, in through your nose, out through your mouth, to support oxygen delivery and manage blood pressure. Prioritize restorative sleep and spend at least 30 minutes in natural light daily to reinforce circadian rhythm and steady energy.
If you're unsure where to begin, start with measuring your cadence and adding a small, sustainable increase. You can build from there: a metronome for rhythm, a couple of short strength sessions each week, steady protein with collagen sources, clean carbohydrates for fuel, and consistent nasal breathing on your walks. These are small levers that compound into greater endurance and confidence.
Your practical challenge today: measure your baseline steps per minute, then complete 3 walks this week at +5 steps per minute. Next week, repeat and reassess how far you cover in 6 minutes or how you feel during everyday tasks. Keep building toward that 14-step increase as it becomes comfortable. Thank you for watching Dr. Mercola's Cellular Wisdom. We'll see you on the next episode.
Thanks for watching. Subscribe now and click the notification bell so you never miss an update. See you in the next video.